Some of the kitchen staff wear disposable masks for as long as an entire month, says Administrative Officer of the Kitchen Department, Fori Noni Shuya. She says management fails to recognize the plight of her team despite countless engagements.
These people work directly with the patients, so they are put at a disadvantage if they have to use a mask for 4 weeks, because that means that the mask is no longer effective. It doesn't serve its purpose anymore. So today they just want to voice out their concerns and just, of course, get our management and, of course, the ministry or the PS or whoever can just hear them out. Today I tried to make another effort to get masks, but to no avail. I can't even get to the office. It's closed, or people are not picking up, or we just hear like, how far did you not get certain masks from your management and so forth. So it's never really clear answers.
Uyama Kahangoro, the Secretary General of the Public Service Union of Namibia, says he has heard his members complain about this issue way before the COVID-19 outbreak, adding that most of the kitchen staff do not have basic gear such as safety boots and uniforms.
This seems to be completely neglected or deliberately ignored by the employer. And for that reason, being the Ministry of Health and Social Services, stewarded by the Minister, Dr. Kalumbi Shangula, who on daily basis at COVID-19 informations and advocates for compliance with the regulations dealing with the COVID-19 pandemic as announced by the President of the country. But yet he himself is not applying the same at his place of work with his employees. And that really defies any logic.
The fact that this is happening amidst the COVID-19 pandemic is disheartening, says Kahangoro. He added that as much as Windhoek Central Hospital staff are experiencing similar issues, it is nothing compared to the situation at the Katutura State Hospital.
If you go visit the hospital, at the Central Hospital, yes, you will observe here and there some non-compliance elements, but are really not to that extent that one should start really complain about. But this one is now becoming inherent, and we can no longer allow the compromise of health and safety of our members, particularly when we are conceived with this difficult situation as a result of the deadly COVID-19 pandemic.
According to Noni Shuya, the PPE shortage forces some of the kitchen staff to not attend to patients, causing them to feel neglected.
I'm a ward assistant in Katutura State Hospital, and I have been working here for 10 years. We have been suffering a lot, and we want the government to help us because I cannot get the same salary as a cleaner of 3,000 Namibian dollars. I have children and a house and bills to pay. Even taxi fare has increased, so we are forced to walk from Havana to work every day.
I work in the laundry department, but our pay slips indicate that we fall in the same category as cleaners. But our work is very different because if you bring a cleaner in our department, they will need specialized training on how laundry works. But if I go to their department, I will just start cleaning.
We are tired of the situation here at Katutura State Hospital. I have served the hospital for so many years that I'm about to retire, but I will have no pension. After suffering for so many years, cleaning feasts day and night, and still our salaries remain the same. Especially now during this time of Corona, and I am still working while I am poor and only getting a mere 3,000 for many years.
PSUN says if the Katutura State Hospital management fails to meet the kitchen staff demands, they will be forced to make use of subsection 2 of the Labour Act, which states that employees can leave their workplace if they feel their health and safety is at risk.